Should every rash that appears on baby's body worry you? Gender-based toys or gender-neutral? Discipline, how and when to do it. All this and more on today's episode of Raising Babies 101. More Raising Babies 101. Carol Ofori. From red spots on your baby's face to a nappy rash, eczema, to even more little bumps on that sensitive skin, we all have had our grandmothers, aunts, friends, and even strangers try and give us remedies to treat them. What are they and what is the treatment? Joining me in studio is Dr. Carol Hlela, who is a dermatologist, to break this down. And of course, a warm welcome to my studio audience. Good morning, Doctor.
Good morning, Carol.
So let's talk about all these different types of rashes. What are they, and how do we differentiate the rash?
You see, Carol, every baby, when they're born, their skin is meant to be smooth. Even as they grow, it's meant to be smooth. But the minute they develop something on that skin, be it bumps, be it just a change of color, that's called a rash. And that means disease. And normally, most rashes are caused by different causes. They've got different causes. They can be grouped into infections, infestations. It could be a sign that there's a failure of an internal organ telling you there's something wrong inside the baby. But it can also be from inflammatory conditions, which is where eczema and psoriasis comes in.
So how do you differentiate the less serious ones to the more the ones that are not that serious?
Baby skin is meant to be smooth. So if there's a rash, to me, that's serious enough. But there will be one or two pointers where a mother has to take the child to the hospital if they have a rash. And those pointers are if that rash is associated with fever, and that is when usually that the rash may be spelling that there's an internal organ failure or there's something wrong inside that baby's body that is manifesting as a rash.
And with Wanaga, I find that with him, he has like a recurring rash. So I could say, it will go away, and then sometimes it's there and sometimes it's not.
Yeah, if it keeps coming back, it's a sign to say, go take the child to hospital.
Can you explain it better? What is eczema?
So firstly, it is a rash. But most oftentimes, a child who has eczema will present, depending on the age you catch them at. If it's very early on, the first few months of life, it might just be dry skin. But beyond that, there will be changes on the skin which will manifest in the form of redness, sometimes scale, but eczema rash will almost always be accompanied with itch. So it's dryness, redness, scaliness, and itch. And it can be anywhere on the body.
Can you outgrow it?
Literature shows that 75% of patients will only outgrow it when they reach teenage years. But then there's this 15 to 20% that will carry on with eczema beyond childhood age.
Okay. I know we've got a question from our studio audience. Making potso ya gago?
Dumelang le kae?
Teng le kae?
Ke teng. Ke Lerato nna ka lebitso. Ntho ne ke batla go tseba ke gore does the tonsils cause eczema?
A patient who has tonsils, that spells low immunity. When a child has got low immunity, then any other thing other than that particular condition they have may manifest. In other words, they may have their eczema that may have been there, maybe in a milder form, worsened during that period when they're suffering from tonsils. But it doesn't mean that one leads to the other.
I got you. Yeah. Got another question, Meputo?
The causes to eczema and the treatment that they treat.
There is no known, firstly, cause for eczema, no one cause for eczema. The speculation is that it's multiple factors playing, I would say, all contributing towards what you see. And the multiple factors include immunity, the baby's immune system, their genetic makeup, and at times, literature has shown that it's also got to do with the barrier defect. So the skin is the skin cells are not completely attached to one another. Instead, the skin is porous, so it's easy for external agents to come through and worsen and cause sensitization and cause eczema. So it's multiple factors all coming together leading to what we see on the outside, but there's no one cause for eczema.
How do we work on nappy rash le cradle cap?
Well, let's start with the nappy rash. The commonest cause for a nappy rash is the one that we all know, where a child is infrequently changed. So you see a nappy rash because the skin is in direct contact with the breakdown product of feces and urine, irritating the skin because they're living together for too long, if I can say it in such simple terms. But that's just one of the many causes of nappy rashes. There are other skin conditions that will manifest in the nappy area, and they don't necessarily spell or mean that a child is not being frequently changed. And there are inflammatory conditions that I was referring to, such as psoriasis. So psoriasis can manifest in the nappy area. Sometimes it might not necessarily be a nappy rash because of infrequent changes, but it may still be contact. A child might be allergic to something that might come from the napkin itself. Now and again, I've seen a child who has developed a rash in the napkin area because they were allergic to the elastic band. So that's another form.
From the nappy
from the nappy itself, yeah.
And then cradle cap, your necking.
Well, cradle cap is, firstly, let's talk about how it looks like, how it manifests. We call it matted. It manifests as greasy scales that are attached one to another. So we call it matted. We call them matted, and they involve the whole scalp. There is no known cause for it, but it's speculated that it's as a result of a particular, we call it commensal. It's an organism that we all harbor, but certain children overly react to its presence. And it's a very temporary problem that they will have cradle cap in the first few months of life. By about 1 year, they will outgrow it without even causing any telltale signs or long-term side effects. It is really a nothing, but it's an over-exaggerated reaction to the presence of a commensal that we all harbor.
So what's your number one advice to batswadi ko gae?
Baby skin is very delicate, Carol. And at that stage, especially first few months of life to about 2 years, it's 30% thinner than mine and yours. It loses moisture sometimes up to 5 times more than mine and yours. So it's delicate, it needs special care. So mothers should be careful what they use on the skin, on the baby skin. Instead, try and use products that have been specially formulated for babies. But if not, they can just use pure water.
Thank you so much, Doctor. Really appreciate that. Some really interesting insight for us. Thank you.
Thank you very much, Carol.
So you've heard it, what to do when you see a rash on your baby. Sometimes something is happening and it's showing a rash. So don't take it lightly at all. Right now, an interesting discussion is going to happen. It's about toys for boys and girls. That's all next on You Decide. Dikoloi and blue are for bashimane, and Dimpopi and pink are for girls. That's what we were always shown. But who decided and when? My audience, do you buy your children's toys based on their gender? Please vote now. Oh, interesting. It seems the majority said yes. Well, we wanted to find out for ourselves. Harasheb.
My name is Lauren, and Kings and Queens Academy is my school. I'm the owner of the school. I also teach the 4 to 5 age group. So the setup that we have today is we want to try and establish whether there is a role between gender-based toys. We know that, usually if you're looking to buy a toy for a boy, you'll buy an aeroplane. If you're looking to buy a toy for a girl, you'll buy a tea set. But are we doing the kids any justice by telling them that you have to play with this, either a doll or you can play with the blocks? So these are girl-based playing toys. So, and then on this side we have boy-orientated toys. We have some kids outside of the classroom that are waiting to come in. They're eager and very excited. They don't know what's about to happen. They have no idea. So what we're about to do now is Wakil and Onkarabile, you can only play on that side of the carpet. This side. Why?
But the T-ball, you want to play? That's the girl side, that's the boy side. They like gifts and hugs and stuff.
Zoe, Isabella, and Letutlo, how do you feel playing on this side and letting the boys play on that side?
I don't feel so nice. I really want to play on the side.
Do you want to play with the teapots?
Me, yes. And you
But today, we want to see if the boys can play with the teapots. Do you think they'll be able to do it?
No.
Okay, so girls and boys, now we're gonna play with everything together. So you can choose what you want to play with and what you're okay playing with, and then you can sit on the carpet and continue to play. Is that okay? We can't expect to grow up little presidents and little inventors if we are going to sit and say, no, you can't do that. Don't play with that. It's not for you. It's for somebody else, or it's for a girl, or it's for a boy. We can't do that to our kids, because then we're stunting their growth, and we're not understanding that their beliefs are more important than our outlook on life and what we think is essentially important and what's not.
Some interesting food for thought there. I'm joined by Faith Gomani, a registered counsellor, and Bradley Daniels, a clinical psychologist, to chat more about this. Welcome to you both.
Thank you so much.
So, Bradley, let me start with you. Are cars for boys and dolls for girls? And who decided this?
No, they are not. The question is that how it is practiced? The answer is yes. That is how it is practiced. That is how it is practiced by marketers since we can remember day dot. If you think about big marketing companies that do toys, they obviously market their toys for girls and they market their toys for boys. But remember that marketing strategies for toys is actually geared at you and me and at Faith as parents. So we are the ones to buy the toys because kids don't have money. It comes from a socialization in society. So if you're a woman, you are somebody who cooks, you take care of babies, and you take care of the house, and you do shopping, and you do all of those things. If you're a boy, you drive a car, you go to war, you have toys, you have soldiers, and you build. So that's the socialization where it comes from. So that's the answer in short.
So, Faith, I have to bring you in here. What lasting effect does it have on children when you are gendering the toys? So the certain toys are for boys and certain toys are for girls.
Okay, like Bradley said, we are socialized to think in a certain way. Okay, so basically what we're teaching the children is that there are specific gender roles that they need to follow. And that does have a lasting effect because that's how we live our lives, okay? So girls know what girls are supposed to do because of how we've been socialized. Even through the toys, you know, we buy our girls baby dolls. So okay, women are nurturers, they're supposed to take care of the babies, they're supposed, you know, so we train them from a young age to think that way, okay? So it's a very controversial subject because is that all women are meant to be doing? And the same for boys, okay? So I buy my son from a very young age. When I go to the shop, I choose the car instead of maybe a house. Okay, so I'm teaching my son that boys drive cars, boys should be mechanics. But is that really how the world works now? So it's all about how we are socialized and then we internalize these gender roles and we live them out.
So I have to ask you, Bradley, what happens if a child, for example, is a boy but wants to play with a doll, or a little girl wants to play with a car?
You say to your child, that's wonderful. What kind would you like? So the reason we do that is because, as Faith has just beautifully described, so we need to understand the difference between sex and gender quite quickly as parents.
Explain to me.
So sex is basically anatomically. So what you have between your legs anatomically, that will determine your sex. So you are male or you are female based on anatomically what you are. Gender is a socialized part of your identity. The first unit of socialization in society is the family. So you, me, Faith, we are the first people to socialize our children, right? And we can do the best that we can with what we have. So if your child says, if your child is a boy and he wants to play with dolls, facilitate the play with dolls.
And what do you do? I mean, some parents will say that it's embarrassing if it happens in front of other parents.
Great stuff. Because it's embarrassing if it happens in front of other parents because the person that we are now challenging is you yourself. They are now struggling with their own socialization in terms of how they were socialized into gender.
When do children start having preference? What age would you say children start having preference for what toys they want?
I would say generally around 3, because before that age, everything you decide for the child. Okay, so let's say my child is 6 months old. The kind of toys I choose to buy are my choice. Okay, so then the child grows up knowing that these are the type of toys that mommy buys. So these are the types of toys that I need to play with. Okay, so I'll just make an example. So if at home, my son has a car and a ball, and those are his toys, and he goes to school and he's given a doll, he's not used to playing with the doll because all the toys that I buy him are a specific types of toys.
So would you say that as parents, we should be more mindful of the type of toys that we buy for our children?
Absolutely. So this is what we talk about when we talk about mindful parenting, right? So as we spoke about before, we have to do the best that we can with what we have at that point in time. So a toy is a plaything. Why is a toy important? A toy is important because it is something which facilitates play. Play is essential for children's development. Children develop and grow through play. So how they play teaches them how the real world looks. So if you look at kids on the playground, the way they are playing, they're starting to understand how to relate to one another, how to relate to people, how does society work. The way you as a parent play with your children, you are also facilitating to them how the world must be.
What is your final thought on what toys we introduce to children and what we are actually saying to them?
Men are basically more active or involved in parenting now, okay? So dads do take over in terms of taking care of the baby, changing nappies and all those things, which was something that wasn't prevalent, you know, 100 years ago or something. Okay, so it's okay to allow your child to explore, you know, in terms of buying toys that are all-rounders, okay? So I can have musical instruments, I can have dolls, I can have cars, and they get to then decide. They get to be exposed to different types. And then when they finally make the decision of what they prefer, then it's easier on the child. They're not confined to a specific way in which they need to conduct themselves, okay? So that they have that expression.
Got you. Well, that makes a lot of sense. Thank you so much for coming in and talking about this. I think what we take out of it is to allow your children the freedom and don't box them into certain things. And don't panic if they pick up a doll or if they pick up a car. It's not a big deal. They're just playing and exploring different things. Let's take this conversation online. Come to Facebook, Twitter, and Instagram and share your thoughts on Raising Babies 101. Don't go anywhere. Se se latelang mo Raising Babies 101. Potty training, discipline, and our celebrity. Ke a go amogela gape mo Raising Babies 101. A wa itse go tlhapisa ngwana gago? Don't stress. That's today's easy peasy. In today's Easy Peasy, and to help me do that, I've got Sister Frida Makanete, a professional nurse and midwife. Dumela me.
Hi, I'm Jan Carol.
So Sister Frida, kopa re tlhalosetsa gore ha re thoma go tlhapisa ngwana re etsa jwang?
Okay. Re tlo qala ka sefatlhego ne. E sungula hi matihlo. So your cotton wool we tsakamisa and then so you will go from this point taking it to the outside.
Okay.
Okay.
So from the cheek side into the corners of the eyes.
Yes.
Okay.
Okay. And then we just discussed the cut that because of we used it. And
okay.
Then okay. And then you clean the face. Now the rest of the face. Okay. So you start up, I guess, and then going
down.
Okay.
So,
that neck. No soap.
Okay.
Ne? So you get the CB ashkandin just to avoid allergies as well because babies are prone to that rash because of their skin is still very new. And then we are done with the face. So should you see it's still a bit moist, you will obviously use excess cotton wool to actually wipe it off. Okay. And then we'll come with the body. This is when you tsakamisa maboko and then sorry.
No problem.
Then your baby wash. We chela. Okay. All right. This is a very good way to bond with your baby. So you will talk with your baby. Yes, it is. And they say you must always ask for permission to actually do this.
Oh.
So this is your way of talking to your baby.
For permission. Nana, permission.
So you just rub your baby, obviously, and the side. Remember, you have moist hands, so that baby wash is going to be soapy around babies. Then you take your baby.
And you must be careful, she can get slippery.
Okay, so remember, I'm a midwife, so I'm so used to picking out these babies.
Oh, so always
but anyway, safety is the very important thing because this baby's neck needs so much support. Okay, then you'll be picking up your baby into the water. Okay. It's always nicer to use a bath with support. Although if you don't have, you obviously need to guard your baby by supporting your baby with your hands. Okay. Then you'll be holding your baby there.
So don't you thusa ka support for ngwana kapo?
Yes, because then it avoids or it prevents. Yes, rattle. So I think kurenje anga ready. Bangwana wa reta. Remember you have soap. So you see, if
you have bucket or basin, what's one?
I think it will depend on the size of the bucket that you are using. Okay.
So very discretion.
Yeah, you just use your discretion. Money, mummies are always having that instinct, so you'll always know. So should it be bigger, you'll obviously need a towel to just help you with the grip. Okay. Then, since your baby is soapy, you'll be pouring that warm water around your baby and you're busy playing with this smiley baby. You need to avoid the eye area and the face.
And then
so we don't have to keep the baby in the water for long. Remember, the temperatures of the baby can drop. Then once baby is out, you pet your baby, cover your baby.
You cover the baby quick.
Very quick, because babies lose temperature very quick. This is a very new baby. Yeah, so we need to always maintain that temperature. So this is a wet towel. Then you get your new towel. Okay, maybe you can help me with that. Please put it on here. Okay, you can just put the towel there. Yes. Okay, come baby. Okay, we remove the wet towel. Put there. We discard. Okay. So now baby is all nice and dry. You have your barrier cream. So you always need to put barrier cream, whether baby has nappy rash or not. You need to have your barrier cream. Barrier cream with your nappy, yes. Okay, so
all right. So we don't have to even do the whole demo. So our fetamo rebe barrier cream, reknya leiri, apisangwana, and an happy little baby.
So another thing that I can add, you can always, because now we used a soapy baby wash. If you're going to use soap, then you put your aqueous cream on. Remember, so some mummies can even use plain aqueous cream to wash your baby. Okay, it's allowed. It's like soap, so you can use it as soap. The nice thing about aqueous cream, it's because now it's water-based, some are oil-based, but you need to use an unscented one. It's very good for baby. It's new skin, it's very sensitive, so it will do the job of cleaning your baby, and at the same time, it will moisturize the skin. So you wash with it, and then you apply it afterwards. It will just keep that skin moisturized.
Very nice, Sister Frida. Safely jwang. And also remember, I think the biggest tip I can give you is that ntsha dilo tse o tlo di berekisang mo ngwaneng pele. O ska ba ha ngwana sa ape a tlhobolile diaparo tsa gagwe so wena so o batla di cream o batla di nappy o batla diaparo. Make sure everything is right there gore o kgone go apesa ngwana ka pele gore ngwana a ska tshwara serame. Thank you once again, Dr. Frida.
Pleasure. Thanks for having me.
Right now though, it's time for our baby shower. Okay, viewers, as we all know, parenting can be very, very costly. To make life a little easier for you, our baby shower segment is here to shower you with gifts. This week, we have a baby hamper to give away. All you need to do is answer yes or no to one simple question correctly. Is spanking the only way to discipline a child? Answer correctly, and one lucky viewer will be randomly selected to win this baby hamper, valued at over 2,500 Rand. The winner will be announced on social media. Good luck! Seselatelang mo Raising Babies 101. Baby's Health A to Z unpacks how deadly bronchitis can sometimes be mistaken for a common cold. And then we talk discipline. Raising Babies 101, and thank you for staying with us. Today's big question is one every parent will relate to. I mean, we all experienced it as children, and maybe not in the same way, but similar ideas. This is today's big question. Kushapangwana kapo
Hi, Raising Babies. I'm Pindo from the East Rand. I'm a mom to a 5-year-old little girl. Her name is Guhle. What is currently happening in my household is that we've got a parenting clash. The problem is that one parent is too lenient and the other is too strict. I believe in spanking and he believes in taking away privileges. What happens, we have a battle, she never eats her lunch. Never. She'll leave in the morning, she'll have her breakfast, and she comes back. She spent the whole day at school, and her lunch will come back as it is. She wouldn't touch anything, not even a bite. First time around, I'll tell her, please don't do it. Second time around, I'll warn her about it. Please don't do it. If you do it, there are going to be consequences. And she understands. But Daddy feels, no, she's still young, let her be. She's still playing with other kids during lunchtime. She doesn't have enough time to eat her lunch, and I feel that's not fair. So he feels we should take away privileges because every Friday she has tuck. So she shouldn't be given tuck. That does not even work. So what should I do now? So I feel a spank is needed, and he feels no. Raising Babies, please help me with tools that I can use in my household to better our situation right now, so him and I can find a happy medium when it comes to disciplining our daughter. Please help him, our main need.
A rather tough one there for Pindo. But here to help us unpack this is clinical psychologist Bradley Daniels. He's back to share some advice on this. Bradley, you saw what Pindo had to say. What do you think about it?
Corporal punishment is a no-no. Period. Done. So
legally
even
as well.
In schools, teachers or educators are not allowed to violate the bodies of children in any way. Every person in South Africa has the right to physiological, psychological body integrity. So I'm going to say quite clearly, hitting your child is not an option, full stop.
Okay. And legally at home?
It's not an option.
Mm-hmm.
If you, and now psychologically, if you are hitting your child, you are violently aggrieving your child, even this.
But now I would argue that I was spanked as a child, and I'll be very honest, I think that it definitely gave me boundaries and it gave me some sort of discipline.
Boundaries and discipline is very important to ensuring that society functions. Other ways of setting boundaries. So you are modeling for your children from day one. Feeding times, keep them regular, on time, on clock. Your responsiveness, you respond to your child on time, on clock.
But that's not in a real environment. You know, you have to work late sometimes. Things might have to change and adjust.
Life happens. Huh?
Yes.
Life happens to us, whatever.
Yeah.
So I'm going to give you the invitation clearly again. On time, every time, impeccably. Your child eats at 7 o'clock every day. There's a funeral, somebody's just died. You need to go away.
So you mean consistently?
Consistently. You then have a discussion with your child if they are old enough. Listen, mom or dad has to deal with something right now. I know that it is now your dinner time, but you are going to have dinner alone with the nanny today, but it is still at 7 o'clock.
How does that bring about discipline if a child decides, you know, children will push boundaries.
Of course.
A child, you'll say, sit down, eat your food. I don't want to. Sit down, do this. I don't want to. So what do you do then?
Consequences.
That's what I want to know. Spanking is a consequence. What other alternatives are there?
These are the alternatives. Spanking should not even be an alternative. If they say, I'm not hungry right now at 7 o'clock, 7 o'clock is your eating time, then that is okay. So then the options that they have thereafter, they will go to bed, either having a snack before they go to bed when they are ready, but you're running around the stove for dinner, for whatever, it ends at 7. So you are off your shift at 7 o'clock. Your no must always be your no and your yes must be your yes.
I've got a question in the audience. Let's hear from our audience member. Sawubona.
Like bengifuna ukwazi ukuthi okay nje asho ubhuti ukuthi spanking is not allowed yabo into ezinjalo. Let's say ufike to that stage that you cannot cope, take it anymore. So what do you do?
When you're not coping, you need to seek professional support to help you. So this can be through reading. Read up, contact a psychologist, speak to friends, your peers, your social support network. Ask them, hey, my child is now that age that I remember one day you were talking about what happened to your child. How did you handle it? What can I do best? Consult.
We go back to Pindo's question. She says she wants to have a happy home where her and her husband can see eye to eye, because she feels when the child has gone beyond a certain point, it's not from the offset, but beyond a certain point, there should be an option.
You see, raising children and parents, what is so interesting is raising children is really easy. It's the parenting that is more complicated. And the thing that is more complicated is being an adult. So in that situation of the viewer, so already I can say as a couple, they need to have some face-to-face time as a couple. They need to figure out what is our value system as a family. My suggestion is that they actually have this written down. And it's written down, point number 1, our child will eat at 7 o'clock every day. Point number 2, she will get 20 rand to go to school. Point number 3, we will decide in unison whether something is okay or not.
Okay.
This is their manifesto, and they sign it and they agreed and they put it on the fridge for the two of them to look at.
But still, Bradley, what is that thing over there?
I'm wondering if I should share it with you, because then my secret is blown.
Let's see the secret. I love secrets.
So this is really nothing magical. This is just a singing bowl. You know what a singing bowl is?
No.
So you can make it sing, but it takes some time to make it sing. But actually, it just makes this noise.
Okay.
So can you hear the linger? It goes on a little bit longer.
Yes.
Huh? So when this noise happens, children should know it's quiet time. Stop what you are doing right now.
Or else?
No, nothing. Stop what you're doing right now and pay attention to me.
I wonder if my 2-year-old will listen to me if I do that.
If you do it consistently, they will. And then we say, listen, that behavior is unacceptable. We spoke about this before, have we not?
It's all in your
tone. Do you remember that we spoke about this before? And normally they start crying, because now they know, oh my goodness,
I'm in trouble.
Why are you crying? What is it that is making you cry? So the new line is learned, but you're hurting my feelings. Okay, tell me how I'm hurting your feelings. And if it is plausible, I say, I'm so sorry for hurting your feelings.
Okay.
However, this behavior needs to stop today.
Okay.
This is what I would like for you to do going forward. Do we have an agreement, young man? If we have an agreement, we shake hands, and I love you, and now you may carry forward.
Thank you so much, Bradley, for that insight on spanking. Really appreciate it. So do you spank your child? Did this conversation change your mind at all? Let's have this chat on social media. Look for us, Raising Babies 101. Don't go anywhere. Sesilatelang, B is today's letter for babies' health A to Z. And then Lion of Judah hitmaker Lebo Sikhobela joins us to talk motherhood. On Babies' Health A to Z, we deal with something that can develop into something worse if not treated correctly. Today we look at B for bronchitis. Bronchitis is inflammation of the bronchi in the lungs. Symptoms include coughing up mucus, wheezing, shortness of breath, and chest discomfort. Bronchitis is divided into 2 types, acute and chronic. Acute bronchitis is also known as a chest cold. We are joined by Dr. Sam Obabuku to unpack this. Welcome, Doctor.
Thank you very much.
So, Doctor, let's talk about bronchitis specifically in babies. How does one identify it, and what exactly is it in them?
Bronchitis, like you said, is an inflammation of the bronchus. The bronchus is the pipe that goes in the lungs. So the pipe that connects all the way from the throat here down into the lungs keeps on going and diverging and splitting up is what we call bronchus.
So the one that supplies air, the airway.
Air, yes. So that's where through where we breathe in and breathe out to the lungs, to connect to the lungs. Okay. Bronchitis is not affecting the lungs directly. It's affecting that pipe, those pipes. I should say pipes that are connecting to the lungs.
How serious is it for babies and infants?
It's common because the virus in the air is very common. Okay, we have a lot of flu. So, and once they travel down to the lungs, towards the lungs, in those pipes, it causes bronchitis.
How do you tell the difference between flu and bronchitis in children or infants?
So it's very difficult to tell without listening on the lungs. You have to listen with the stethoscope that the doctor uses to listen.
And what do you hear? I'm always so curious. What do you hear? What sound is it?
It's better experience than imagined. It's good to learn that, but apparently we listen for sounds that doesn't tell us that it's pneumonia.
Okay.
Or sounds that doesn't tell us that there's danger that is coming from the lungs. Okay, if it's coming from the lungs, like in asthma and in pneumonia, what you're going to hear is different sounds that suggest pneumonia.
Okay.
Then we can zero down on inflammation, that's the sounds you can hear, which are actually not particular. They're not spectacular sounds.
Can you prevent bronchitis in babies?
It's not preventable because it's a virus. Okay. We have, just like you cannot prevent flu per se, flu is a virus. So the bigger problem we have, that's why I say this topic is important, is that parents are so concerned about bronchitis in their children that they forget to understand that bronchitis is due to secretions that are produced by this infection in the lungs.
So like washing your hands, can that help manage and protect and not pass on?
Not really. Washing your hands can prevent what you take into your mouth, right? But these things are in the air. It's just like flu is in the air.
So there's nothing you can
do. There's nothing much we can do.
Is that
why there are some things we can do in terms of little babies, right?
So keeping them away at home?
Yes. So we know that children that go to crèche are more likely to have bronchitis and other infections around than the ones that stay at home. We also know that children that are well breastfed are more likely to have less of those infections, like bronchitis, than children that are mixed fed, like they get formula feeding and other things, right?
Oh, wow.
So if you feed your child exclusively for the 6 months, we don't expect him to have the bronchitis, for example.
Oh, I see. Yes. That's very, very interesting.
So we also know that children that are kept in an environment where they are well fed, that well looked after, are less likely to have chest infections.
Are there home remedies for moms and dads at home for bronchitis?
Yes. Most important thing is, please, I urge parents, do not go to the hospital and when they tell you that your child has bronchitis and you say, doctor, please give me antibiotics. Okay. It's a very common finding. We think antibiotics cures everything in the world, but it doesn't really cure bronchitis because bronchitis most of the time is viral. It's caused by virus. So when some disease is caused by a virus, if you give antibiotics, which is supposed to cure bacteria.
Oh, so what do you give for bronchitis?
So you have to manage the bronchitis until it gets away. The virus has to get away. So the body actually fights virus.
How do you manage it?
What you can do is what we call symptomatic management. Let's start with what you can do at home. Okay, I urge parents to do the basic stuff that they do. It's not about cough syrups. It's about inhalation, steam inhalation.
Steam inhalation. Yes. So a bowl, cloth over.
Yes. Be
now
careful
it's a small
not to
baby.
burn the baby's
what do you
face
do?
Anyway.
Yeah. Oh,
but,
okay.
Not too hot that the child will be burnt. So
and humidifiers? I know they're expensive, but
expensive, but you know you can actually create your own humidifier.
How do you create your own humidifier?
It's just that steam is a humidifier already.
Oh, so having consistent steam in the room.
Steam from the boiling it can humidify the room.
Oh, that's interesting because
so
they're quite
if
pricey.
you can put the child closer to the steam and he blows and it takes it, it actually what it does is that
without burning them, of course, be very careful.
Be careful, yeah. What it does is that it softens the mucus, the secretions.
So the baby sneezes, achoo, and then you get all the parcels on there.
So the more he gets out those secretions, the more he gets better, right? And we also need to understand that bronchitis will take at least up to 3 weeks to clear the cough. So don't be so worried about a child. I used to tell my patients, the parents, if a child has cough and is running around, don't worry.
He'll be
worry
fine.
about a child that has cough and what? Is sick, doesn't want to eat, doesn't want to do other things that kids do. But the child has cough and running up and down. That child most likely has bronchitis, and that child most likely within 3 weeks, it will be cleared off. What is actually causing the lung period of cough is the secretions in the bronchus, those pipes that needs to come out.
Can I pass it on through my breast milk if I've got bronchitis to my child?
If you have bronchitis and you're breastfeeding your child, the chances are that you are developing antibodies. Okay. That antibodies passes through the breast milk and protects the child.
Oh, so it's good.
That's so if you have it and you have developed the antibodies will go through the breast milk.
How do I know I've developed the antibodies?
The body does it.
Okay.
You don't need to worry about it.
So I should be breastfeeding when I've got bronchitis. It helps.
It's perfect. But if it goes beyond 3 weeks, I will advise you to see the doctor because definitely something else might be going on because usually most bronchitis, most of them will resolve within 3 weeks, 2 to 3 weeks, yeah.
Thank you so much, Doctor. A nice picture there on bronchitis. Really appreciate it.
Thank you.
So you've heard it all, but we want to hear your views as well, your experiences. Share them with us on social media. Stay with us. More on Raising Babies 101 next. Raising Babies 101. She came up with a massive hit, and the next thing we were all singing Lion of Judah. But she's also a mother to Lesedi, Lesego, and Letabo. Welcome Lebo Sekobela to Raising Babies 101. Welcome, Lebo. So you've come here with your beautiful family. Welcome.
Thank you so much, Carol. It's good to be here and seeing this beauty and just reminded how beautiful it is to be a mom.
Yes, being a mom. Yeah. And I know your kids are here with us.
Yes, yes.
Tell us about your children.
Wow, God has blessed me with 3 beautiful kids. Letabo, who is now 20, and Lesego, she is now 16, and my boy there, Lesedi, is now just 10. So yeah, it's an awesome time to be having them.
Oh, wow.
Yeah.
So since we earlier about discipline lebana. What type of discipline do you have, Montlung?
Sure. I think discipline goes it's a twining, you know. I think with me as a mother, most of the time, so you'll find that the kids, they are there, you know, looking after themselves, also having like somebody to take care of them in the house, you know. So whatever, probably a nanny, if I may say, you know, or a child minor who's taking care of the kids in the house, and taking, you know, fizzy drinks, you know. So it's important that you teach your kids and not to do. And also to teach them the word of God, because that's a guideline and the principles, you know, that at this time you pray, this is what you do. If other kids about so, you know, this is how you react, you know, you don't, if you go to an elder, you know, or a teacher, so discipline, you can put it together like but, you know, everything that you're doing, it's something that is building your kids, you know, for the future. So it's
the type of toys you bring into your home. And most of the times, what is your view of toys and what you introduce for your children?
Sure. I think toys, it's that thing they can learn a lot out of the toys. I can teach my son, you know, about Dolia Yamanyana. This is a girl. Manyana only 1, 2, 3, 4, 5.
So the issue if Atamika Kadimpopi.
If Atamika Katona.
Your son.
Yeah, I know more kitlabanali issue. But I just teach Wanaka Hore. King Wanyana or this is what a girl is having. This is what you don't do to a girl. It's you know, and then you see other things. So that is what I'm teaching my child. You know, but if I told doll way okay, then you know, and not that gender based whatever telling things before. It's some of the things that you see now. You know, you see as a girl, and then after some time, you know, their hormones change or whatever. So we're still learning because it's like, you know, you just start seeing, you know, certain things. It's a chinchang bophelo.
Yeah. Thank you so much, Lebo, for your time and bringing your beautiful family in as well to come and share this experience with us. Thank you so much. Do get in touch with us and continue with our conversation online. Thank you so much for watching. Catch us again next week. And remember, until next week, bye-bye. Welcome to Pep Talk, the parent's guide to everything to do with you and raising your children. Bath time can be a fun and relaxing ritual for your babies. As for mom and dad, it's all about being prepared. Today, I'll be giving you a list of all the things you need to make bath time pleasurable for you and baby. Newborns in all their gentleness don't need to be bathed every day. You can bath your newborn 2 to 3 times a week. In between baths, you can wash your baby's face regularly. Use a soft face towel like this one. Clean your baby's bottom after each nappy change. When bathing baby for the first time, it might be advisable to do it as a team, mom and dad, as it can be a daunting task. Always check the temperature of the water with your elbow or wrist before you place baby in the tub. Water that is too hot could burn your baby, and if it's too cold, it could make them uncomfortable. Now that you know the how, the next question is what? What do you bath your baby in? If you don't have access to a baby bath, you can bath your baby in your basin. Avoid big baths, as these are both uncomfortable for you and unsafe for your baby. Also make sure that the product you use is safe for your baby's skin, like our Cuddle Some range. Catch us next time right here on Pep Talk for a helping hand through your parenting journey. If you want to stand a chance to win some exciting giveaways, get onto our social media pages quick and enter our weekly competition. See you next time.